Relative to its size, the eye is considered by many clinicians to hold more diagnostic information than any other organ in the body. Before we start the details of the examination, please review this slide and the next 3 anatomical slide images. First, carefully observe the areas of the lacrimal glands and the lacrimal sacs for evidence of swelling. Inspect the eyes for bilateral symmetry, paying particular attention to their position, alignment, size of pupils, and clear definition in the markings of the irises. Take note if the sclera is visible above the iris when the subject looks downward. Some degree of exophthalmos is present, suggesting a possible hyperthyroid state. Ask your patient to gaze at something behind you. Then from a point outside the patient's line of vision, shine a light upon each pupil. Inspect for pupillary constriction in the illuminated eye, direct reaction, and in the non-illuminated eye, consensual reaction. Now request your patient to look at a distant object and then shift to a small object held 3 to 5 inches in front of the bridge of her nose. Inspect for convergence of the eyes accompanied by pupillary constriction. Then ask your patient to follow with their eyes the movements of a finger or a pencil held at a comfortable distance. Note any abnormality in the movement of the eyes. Seat the patient in a dimly lit room. Shine the beam of light on the subject's pupil. If positional relationships are correct, a reddish glow, so-called the red reflex, should fill the pupil if the glowing area shows dark spotting. Some lens opacity may be present. Viewed through the pupil, the retina should come into focus with only minor lens adjustment. If the subject is nearsighted, that is myopic, a negative correction will be required to focus more into his elongated lobe. The short globe of the far-sighted hyperopic individual requires a positive correction to bring the retina into focus. There are 6 anatomical sites or landmarks that should be identified. They are the optic disc, the physiological cup, the macula, the veins, the arteries, and of course the retinal field. Within the area in view, look for the optic disc. It is a round, yellowish structure perforated by the retinal vessels. If the disc is not in the field, identify and follow a vessel in the direction of its increasing diameter, that is, centrally, to locate the disc. The shadow of the physiological cup should be identified. Focus the disc sharply and inspect its perimeter. The margin should be clearly defined except along part of its nasal edge. Shift your attention to the vessels and differentiate arteries from veins. The arteries are smaller, light red, and tend to reflect light rather brightly. Note the stark difference in a normal fundus from the disc of a patient with glaucoma. There are several disorders of the eye grounds that exhibit key points of identification by ophthalmoscopy. Characteristically, the disc takes on a cupping appearance in glaucoma. Observe how the high pressure of glaucoma causes a cupping of the optic disc, and that it appears intensely bright because of the surrounding pigmentation in the retina. The disc appears white or gray in color, with diminution or absence of the arteries, and the veins are normal in optic atrophy. The disc appears elevated, swollen, and takes on a puffy or fat appearance, with the margins blurred and the vessels engorged and tortuous in papilledema. Optic neuritis appears with the optic disc elevated with blurred edges. The retina presents with mild parapapillary edema and a mild dilation of the vessels over the optic disc. Scattered particles of pigmentation about the retina in a classic bone spicule pattern is typical of advanced retinitis pigmentosa. Note that the vessels are greatly attenuated. Closure of the central retinal artery results in a very pale retinal field and loss of disc clarity. Occlusion of the central vein produces vessels that are tortuous and dilated. You will note there is extensive retinal hemorrhaging, and the disc is obscured by edema and hemorrhage. In this example of retinal detachment, you will observe a gray wrinkled elevation that usually is seen in the temporal area of the retinal field. Note that the blood vessels appear tortuous over the detached area and the optic disc appears normal. Non-proliferative diabetic retinopathy reveals numerous scattered retinal exudates and retinal hemorrhages, in addition to a mild dilation of the veins. The disc appears normal. Patients with a proliferative diabetic retinopathy will exhibit a network of new vessels growing from the optic disc, and in addition, the retina reveals a number of hemorrhages, hard exudates, retinal infarcts, sometimes called cotton wool patches, and of course many dilated retinal veins. End-stage diabetic retinopathy will demonstrate marked to complete retinal and disc obscurity by fibrovascular proliferation, and none of the retinal landmarks are visible. An elevated edematous disc with blurred margins is characteristic of hypertensive retinopathy. Also, you will usually see heavy exudates and inflamed appearing hemorrhages with attenuation of the retinal arteries. The patient with macular degeneration presents with a marked hemorrhagic macular degenerative process coupled with the loss or attenuation of all the retinal landmarks. Macular drusen exhibits a retina revealing extensive areas of white drusen, which are small globular hyaline excrescences. The optic disc and vessels do appear normal. Patients with inactive chorioretinitis or toxoplasmosis will show a well-circumscribed lesion with areas of hyperpigmentation and atrophy of the retina. Now, before we close this section on the eye, I want to emphasize that as your reputation grows in your community, and perhaps even in the surrounding states where you practice, You will begin to see patients with grave health problems and major pathological eye disease, as we have demonstrated here. When you see these patients, make certain you study closely their eye grounds, time and time again, as you treat and follow them during whatever time you are privileged to serve them, and perhaps this may be for the rest of their life. Closely studying these conditions will greatly improve your diagnostic acumen and markedly improve your overall clinical skills as well.